Back PM on the Newsfeed PM. Thanks for staying on. This year, World Diabetes Day's theme is diabetes and well-being, marked annually on the 14th of November. World Diabetes Day is about raising awareness around the disease as well as the prevention, diagnosis and management. Now, according to the University of Pretoria's Diabetes Research Center, approximately 1 in 9 adults suffer from diabetes in South Africa. In the recent past, there has been a notable rise in type 2 diabetes in the country. For more on this, I'm now joined by the Deputy Minister of Health, Dr. Joe Phaahla. Deputy Minister, good to have you. Thank you very much for your time. And the global prevalence of diabetes has nearly doubled if you look at the numbers since 1980, from 4.7% to 8.5% of the adult population. What does this reflect about, I suppose, our efforts and our messaging around the disease, the risk factors, and so on and so forth? Deputy Minister? All right, I think we've lost that connection there. Let's try and re-establish that connection. Some network challenges there. Nelson Mandela Bay Mayor Babalwa Lobishe has unveiled the Metro's new mayoral committee. The committee is dominated by ANC councillors, while the EFF secured the portfolios of electricity and engineering and treasury. Abantu Integrity Movement's Mkuseli Jack has been appointed MMC for corporate services. Lobishe was elected last month after the National Alliance's Gary van Niekerk resigned. All right, we've got the Deputy Minister back with us. Deputy Minister, I was saying that if we look at the global prevalence of diabetes, the numbers would have indicated, at least in 2023, that these have nearly doubled since 1980, from 4.7% to 8.5% of the adult population. I said, what does this reflect about our messaging about this disease, how we are communicating, for example, the risk factors?
Well, it means there's still a lot of work to do in terms of health education, but I mean the growth also is a reflection of the lifestyle. One is the lifestyle changes. As you know, it moves together with rapid urbanization, people moving from rural areas to urban areas, away from certain lifestyles, from a rural lifestyle to urban, but also, you know, in terms of living longer, you know, the more people live longer, diseases of lifestyle, non-communicable diseases also increase. But it essentially means that there is a significant change in terms of the kind of lifestyle of society, and it needs a lot more health education.
So, and previously we were talking that, well, the more affluent people are becoming, their lifestyle changes, they indulge in all sorts of things, and then their health deteriorates. However, the WHO is now saying the prevalence in high-income countries is now lower than what you are seeing in low and middle income countries. So the rich are now maybe not doing what we thought they were doing, while the poor are now the ones who are unable to take care of their health. What is happening there?
Well, I mentioned rapid urbanization. Now, rapid urbanization and what that fact also attests to that, to say, you see, rapid urbanization means a change of quality and lifestyle, but it doesn't mean that as people move from rural lifestyles where they would walk a lot, they would eat natural food, it doesn't mean when they go to urban areas, they can access, you know, some of the, you know, facilities which will enable them to keep healthy. They end up more overcrowded, eating a lot of junk food, hustling and bustling, and you know, quite often in taxis and other modes of transport, and less walking, but especially in terms of when it comes to nutrition, with a very poor nutrition as compared to when they were in rural dwellings. But the more affluent, have more access to better services. And so urbanization itself does not necessarily mean a better quality of life. So I think that's why, because the rapid urbanization is quite a lot in the low and middle income countries, and it does not necessarily lead to better quality of life.
Yeah. Now, it's not something that I hear us talking about a lot in Parliament. I don't know, maybe lawmakers do talk about it a lot and they interrogate it with a finer tooth comb. Do we have a national policy for prevention of diabetes, as the WHO would have reached a resolution in 2007 that each nation should at least have one?
We do have at the national level. I think what is lacking is probably, messaging, a very, effective messaging. We do have a policy and a strategy in terms of prevention of non-communicable diseases, with a strong emphasis amongst those in prevention of non-communicable diseases as a whole, but including also we have a separate and additional strategy in terms of obesity prevention and reduction of obesity. I was in a SADC meeting just day before yesterday in Harare, and in the evaluation on performance of countries, it was reported in that meeting that South Africa were still leading in obesity, and especially amongst women. So even though we've got the strategy, we've got the plans adopted, but I think we are lacking in terms of effective mobilization and awareness and change of lifestyle amongst our communities.
Yeah. What is our system for surveillance? I believe countries like India have got quite a sharp one as far as the surveillance system that they've got in place. And what are we monitoring? What are those parameters that we are looking at?
Well, the reason why we do have figures, for instance, in terms of obesity, the extent of, is because at the regular visit to our health facilities, the primary health care nurses and also primary community health workers do take measures in terms of the weight and the height and weight. In other words, the body mass index, which we, on a regular basis, if you go to a health facility, it's supposed to be, and you're supposed to be guided in terms of saying your body mass index is out of proportion. So we do have those measurements, but I think in terms of proper messaging and guidance in terms of if your body mass index is out of proportion, how do you bring it down? What are the steps which you need to take? I think we're lacking in terms of campaigns in that regard, but we do have the measures. It's not as strong as, for instance, in children, the road to health chart of children, where we map out every time. So quite often, I think also because of the pressure of work, not every time when you do visit a health facility will your body mass index be reported to you, sometimes because of work pressure, but it's in terms of healthy lifestyle, that is actually supposed to be a part and parcel of, when you say it's important that at least once a year, even if you feel healthy, and at least once every 6 months, if you feel any particular symptoms, you must have, you mustn't wait until you're sick. That health check at the annual or every 6 months is supposed to include your body mass index, and which should give you a sense if you are out of proportion.
Yeah. Now, of course, those with diabetes would face a lot of challenges, conditions at work, conditions at home, conditions at school. What are we doing as far as care and support for those already with diabetes?
There is, I mean, first of all, just to remind everybody that one, if you feel the symptoms, just general weakness, feeling excessively thirsty, drinking a lot of water, passing a lot of urine regularly, those are some of the symptoms which should alert you. If it's quite advanced, even the eyesight may start to get weak. Once that happens, you must get closer to your health facility, get checked. But in terms of prevention, the things which we mentioned in terms of regular exercise, avoiding fatty food, too much starch, too much sugar drinks, all those could avoid. But once you have been diagnosed, first line of treatment is dietary. If it's just a little bit high, not so much of other symptoms, just diet itself, just change your diet can bring down the sugar. But if it's already quite advanced and if diet does not bring down the sugar, then you have to be started on treatment. And in terms of type 2, it can be oral treatment. But of course, with children with type 1, they have to be put on insulin. But if it's not controllable in terms of oral tablets, then you have to be introduced to insulin. So we do have, at this stage, there was a time when we had some shortage, and we've been talking to the producers in terms on the insulin side. Even then, it was not total shortage, but it was in terms of insulin pens. But we are talking to the company to make sure that they can continue to produce those. So we do have the remedies, the therapeutics to can help those who need control of their diabetes level.
Yeah. Now, why do we mark these international days? What do you hope to come out of a day like what is being commemorated there in the Northwest?
What we hope to come out is firstly in terms of, that's why in a function like this, we always make sure that we've got a message. Firstly, for those of us who are in charge of the health services, to remain on alert, for the health workers to remain on alert, to continue to, with health education. So it's a way of recommitment, but also to commit ourselves in terms of the community and public education, the need to make sure that the messaging, out there reaches out. So a day like this is supposed to be a really a reminder for us and to add impetus in terms of our advocacy campaigns and commitment to make sure that people are aware and they seek health, they approach health facilities. As we are here this morning, already just under 1,000 people have been tested for diabetes. So this is really just to add impetus to our work of mobilizing society.
Deputy Minister, we appreciate your time. Thanks for your intervention tonight, rather this afternoon, I beg your pardon.